In this Testosterone Replacement Therapy TRT Total Guide to Optimal Delivery video, we are going to discuss how to avoid injection pain, post-injection pain PIP and local injection site reactions, how to reduce injection reactions and pain, and the best alternative delivery method to TRT injections. Hi and welcome back to the channel. If you haven't already, make sure to subscribe and hit that notification bell so you don't miss anything. And before we start, just this. I recently started a Facebook group called TRT and Hormone Optimization Therapy, HOT. I invite you to join this closed group if this topic is something that interests you and where more personal questions can be shared. Okay, let's go. How to avoid injection pain. Inject intramuscularly but rather shallow, not too deep, or inject subcutaneously. Both these methods have been proven to be equally as effective as injecting deep, IM. Rotate your injection sites. Intramuscular can be glutes, delts and or quads. Subcu can be abdominal, glutes and or into the love handle. Use the smallest appropriate needle size. The smaller the needle, the less painful the injections will be. For subcu injections, you can even use insulin syringes and needles. Inject with the finer side of the needle. Inject very slowly. Use smaller injection doses and more frequent injection intervals. This will also be beneficial to minimize fluctuations in the testosterone concentrations in the blood. Post-injection pain, PIP and local injection site reactions. As a dermatologist, I often encounter patients with local injection site reactions and inflammatory post-injection pain, PIP, whether these injections were done intramuscularly or subcutaneously. Post-injection pain, PIP, is very common. Research suggests up to 40% of those who receive testosterone injections describe it as painful. Inflammatory post-injection swelling is described by 10% of patients receiving TRT injections, of course not always, but at least once in a year. Here you can see some painful, inflammatory, red and hard subcutaneous nodules that appeared 24 hours after injecting Sustanon 50 mg subcutaneously. These reactions appeared after 5 of the 7 injections that were done twice a week. Each time another injection site was used. The reactions were painful up to 7 days after injecting, and a hard nodule could be palpated even 2 weeks after injection. How to reduce injection reactions and pain. First, you have to realize that most reactions to TRT injections will be temporary and will probably not cause any serious problems. However, if any doubt, go find yourself a medical doctor that can help you out. This is only general advice, and without studying the skin up close, it is impossible to give any personalized advice. Next, it is important to make a distinction between an infection and purely inflammation. Signs of infection are, next to redness, swelling and pain, systemic reactions like fever and or the presence of pus at the injection site. This can be under the form of a pustule or an abscess. In case of an infection, you really need to go see a doctor to get a prescription of local and or systemic antibiotics. If there is only inflammation under the form of redness, swelling and pain, and the feeling of a hard subcutaneous nodule or lump, then the following actions can be taken. You can be conservative and just wait it out. In most cases, the inflammation reaches its maximum after 1 to 2 days and then slowly fades down. The whole process can take up to 2 weeks. Sometimes a painless subcutaneous lump can still be palpated months after the injection. Next, applying cold, like a cold compress, can calm down the inflammation. You can, for example, apply cold compresses twice a day for half an hour. Local application of creams containing the anti-inflammatory cortisone can be very helpful. Systemically, an antihistamine drug can help with the swelling. A painkiller can of course help with the pain, type paracetamol or aspirin if you're not allergic to it. And a non-steroidal anti-inflammatory drug can be useful to fight the pain, the swelling and the redness. These drugs are more than just pain relievers, they also help reduce inflammation and lower fevers. the best alternative delivery method to TRT injections. More and more men prefer to use scrotal application of testosterone cream over gels and injections for their TRT. And that is with good reason. Scrotal skin is thin and has high steroid permeability. The cream we are talking about is a testosterone cream at 200 mg of micronized testosterone per 1 gram, 20%, in a lipoderm base or versa base. You can't apply any alcohol-based preparation to the scrotum as it will burn and irritate the skin. My Belgian pharmacist uses Pentravan cream base by Fagron, a unique oil-in-water emulsion with a liposomal matrix which enables it to establish a greater rate and extent of absorption of the drug than other transdermal bases. This cream should be applied twice daily transscrotally to a freshly shaven scrotum. The exact needed dose can easily and accurately be measured by a topic-lick dispensing system, delivering 0.25 grams of cream containing 50 mg of testosterone per audible and tactile click. Typical dosing is 2 to 3 clicks, delivering 100 to 150 mg testosterone twice a day. With regard to transference, sexual contact should be avoided for 4 hours, as well as showering or bathing after application of the cream. Studies have shown that testosterone administration to scrotal skin is well tolerated and produces a dose-dependent peak serum testosterone concentration with a much lower dose relative to non-scrotal transdermal route. When you want to test your levels of testosterone, you should do this 5 hours after application. Dr. Keith Nichols, why do we want to wait 5 hours after application of the transscrotal testosterone cream before we have lab work done?
I will read the text exactly as Dr. Keith Nichols sent it to me only yesterday. With regard to timing, this is where practice in medicine as both an art and science, along with clinical experience, all merge. All of the literature states that levels must be monitored, and it is also in the guidelines. The guidelines will tell you when and how to test a man's testosterone levels in order to diagnose hypogonadism, but the literature and guidelines don't tell you when to measure levels they find so important once treatment has been initiated. The Endocrine Society guidelines, for example, state that we recommend making a diagnosis of hypogonadism only in men with symptoms and signs consistent with testosterone deficiency and unequivocally and consistently low serum concentrations. We recommend measuring fasting morning, a time given, total T concentrations. And after treatment, they recommend in hypogonadal men who have started receiving testosterone therapy, we recommend evaluating the patient after treatment initiation to assess whether the patient has responded to treatment, is suffering any adverse effects, and is complying with the treatment regimen. No time given. So, at what time should we test? We know about the pharmacokinetics of testosterone administration by the various routes. We know that there is a peak and a trough with all testosterone delivery systems, and that the measured serum testosterone levels will vary based on the timing of testing with regard to those peaks and troughs. With regard to the scrotal administration of testosterone, we see that there is a peak approximately 2 to 3 hours after administration, and levels slowly drop until the next dose administered. So, should we test at the peak or at the trough? If you want a higher number, then you can measure toward the peak. If you want a lower number, then you can measure toward the trough. The peaks and troughs with twice daily transscrotal application is minimal, a small sine wave. After years of measuring the levels in myself and patients at all the various times, from 1 to 12 hours after application, the levels obtained at 5 hours provided the number that pleased both me and the patient. Through years of experimentation, I found that the levels obtained at 5 hours gave a level that correlated well with symptomatic improvement, and the numbers once again pleased myself and the patient. I found that when the free testosterone levels were optimal at the 5-hour mark, it correlated well with the symptomatic improvement I was seeing in my patients. So, as you see, there is no guideline for how to do this, as it is an art, science and clinical experience. If you want a higher level to make you feel better, then one can test earlier. If you want a lower level, then you can measure later. With those that inject, they prefer to measure at the trough, so as to catch their levels at their lowest, and prefer not to measure it at the peak, as it would be too high for some. This is why I prefer the twice daily transscrotal application, as there is no significant difference between the peak and trough. Like I said, just a small sine wave, 24/7.
Here are some more advantages of using this method of TRT. 1. It seems obvious that the chances of secondary exposure to others are much less because of the site of application. I think it's safe to assume that your family members don't touch your scrotum that often, right? 2. Because of the higher concentration, much smaller amounts of cream are needed, 0.50 to 0.75 gram per application. 3. Pharmacokinetic studies on the absorption of testosterone cream on the scrotal skin show 8 times higher absorption rates than on the shoulders. 4. The cream base is much better tolerated than the hydroalcoholic topical gels, regarding skin irritation and discomfort. 5. Twice a day application ensures less fluctuations in the testosterone concentrations in the blood. With scrotal application, there is only a smooth linear peak felt throughout the day. 6. Higher DHT levels are responsible for better libido. Twice daily application on the scrotum definitely produces the best libido boost and sexual function enhancement. Energy is great all day with the typical twice a day administration. 7. More efficient in bringing up the testosterone levels in the high end of the normal range, which is of course better to alleviate all the signs and symptoms of testosterone deficiency. Next to helping optimize the normal functioning of the male endocrine system, strengthening the bones, being cardioprotective, keeping a high insulin sensitivity, and many more health benefits. I know several men using this method of TRT and repeatedly have total testosterone levels in the 1500 to 2000 range. No need to say, they are free of all low T symptoms and feel great. 8. Using a small amount of testosterone cream as a method of TRT brings along way more easier options when traveling. You do not have to travel passing airport checks and so on, bringing along syringes, needles, ampules and more. 9. Obviously there is no pain from injections, no injection site reactions like nodules and lumps, which are not so rare and that I already talked about in this video. If you have any more questions on this transscrotal testosterone cream, check out this video where I answered the most frequently asked questions on this topic. Thank you for watching this video till the end.
Please like and subscribe. Thank you.